Hi, in this video I'm going to take you through some of the important antimicrobials quickly so that we can remember the important mnemonics which you need to know about them. This is Dr. Deepika Tikku from Simply Pharmacology and let's get started. Now first is the drugs affecting the protein synthesis. So how do you remember drugs which are acting on either 50S or the 30S? So simple to remember, we have these two subunits of ribosomes. Now 50 is a bigger number. So remember people at 50, जो 50 के हो गए होते हैं, they are very calm, right? Calm हो जाते हैं. So remember the mnemonic calm at 50. So they are calm at 50. So they are calm at 50, these people. So how to now go about it? Let's say this one. So calm is, C is for chloramphenicol and clindamycin. A is for your aminoglycosides, but aminoglycosides can either 30 or 50, so they can be both ways. L is for linezolid. M is for macrolides. So all these drugs, they act at the 50S ribosomes and they affect the protein synthesis. So even the S can be made use of 50S ka. This is your streptogramins. So this is the drugs which are actually going to affect the 50S. So 50 mein people are calm. So remember calm at 50. 30 is a younger age group. So people are more vigorous, more energetic. So they are like cycling at high, exercising and cycling. So remember cycling at 30. So cycling hum younger age group mein they are like very vigorous karte hain. So cycling at 30. So the drugs which have cycle in their names, they are going to block the 30S ribosomes. So for example, we have tetracycline and tigecycline. So these are the two important drugs which act via the 30S ribosome. So easy to remember which are the drugs acting at the 50S, which is calm at 50, and at the 30S we have the cycle because they're cycling, energetic hai. So remember the cycle, jisme cycle aata hai. Second important thing, drug acting against the anaerobes. Again very important, which are the drugs which act against anaerobes. So remember this mnemonic, Linda eats chloramphenicol in metro van. Linda eats chloramphenicol in the metro van. So that is your drugs for anaerobic infections. Linda actually is your clindamycin. ठीक है, Linda इसमें बीच में आता है. Chloramphenicol as it is. Metro is metronidazole. Van is your vancomycin. So another way to remember is like Clinda eats chloramphenicol in metrovan for anaerobes. Then the third important group of drugs you need to know are your anti-pseudomonal drugs. Anti-pseudomonal drugs. Isme there are a lot of drugs like we have your beta-lactams, penicillins, carbapenems, cephalosporins, aminoglycoside, colistin, ciprofloxacin. All of these drugs are going to be effective against the pseudomonal infections. So we have penicillin groups, and under the penicillin, which are the penicillin drugs which are anti-pseudomonal? We have to remember those. So remember, so Campty, C-A-M-P-T-Y. The Campty falls in Missouri. So Campty, uska spelling different hai. So remember Campty like this in Missouri. And that Pseudomonas aeruginosa is also found in the water. Source hai water mein. So ye Campty falls hai. So anti-pseudomonal. So jo penicillins hai, that's your Campty wale. And C stands for carbenicillin. Right, C stands for carbenicillin. A is azlocillin. M is mesalocillin. P is piperacillin. And T is ticarcillin. These are your anti-pseudomonal beta-lactams. ठीक है, penicillins, very important to know. So Campty falls. These are your beta-lactams which are anti-pseudomonal. Then you have your carbapenems. We have cephalosporins. Only the fourth and the third generation. Fourth में तो दोनों हैं जिनमें pi आता है. You know that they are the fourth generation cephalosporins. So cefpyrome and cefepime. और third generation में सिर्फ दो हैं. Anti-Pseudomonal, ceftazidime and cefoperazone. These are the two third generation ones. Then even aminoglycosides, colistin, ciprofloxacin, they work against the Pseudomonas infection. So these are your important mnemonics, some tips to remember certain antimicrobials. So starting with this, protein synthesis mein ho gaya, calm at 50, cycling at 30. For anaerobes, Linda eats chloramphenicol in the metro van. And for the anti-pseudomonal penicillin groups, you know the CAMT falls. CAMT का full form आप याद रखोगे. So with this, we come to the end of this quick revision for the important antimicrobials. So see you. Thank you so much. We'll be coming up next week again with a new video targeting a specific question. And so take care and all the best for your upcoming exams.